Hi guys, Will here from East Cliff Physiotherapy. Today we're going to go through a simple bit of advice for acute neck pain today. Acute neck pain can cover all manner of evils. It can be muscular tension type pain, but it could also be caused by irritation to some of the joints in the neck, maybe even the disc, maybe even the nerve, unfortunately. Now, the kind of pain that this will feel like is when you turn your head, it might feel very stiff, might feel very sore, might find it difficult to move into the movement. It could also cause a bit of pins and needles and numbness to go down the arm, even as far as the fingertips. People sometimes describe it a little bit like an electric shock, numbness, weakness. What that means is that somewhere, probably up here, in where the neck joints are and where the nerves come out of tiny holes called foramen, they've been either irritated, possibly trapped or impinged. It's very rare. There's a common myth out there that people think that any pain in the neck, especially going down into the arm, is because it's a trapped nerve. Not always. It's actually sometimes more of an irritation, a chemical irritation, inflammation around this area that's causing the pain to refer down the arm, much like sciatic pain that goes down the leg. So what we're going to do today is go through what you can do if you wake up with a few of these symptoms. So like we've always said, get your pain relief on board, paracetamol, ibuprofen. Don't be afraid to use your ice and heat or your gels. Get those on board maybe before and even after the exercises. Obviously, things that can cause this kind of neck pain could be the certain postures we've been holding, especially when working at home in home office setups that maybe aren't quite right. And if that is something you're worried about, we've got a lot of information on our website, or do get in contact. We'll be able to give you really good information about how to set up your desk at home whilst the lockdown's on to hopefully make it work better for you. So if you are getting some of this pain on the neck, maybe every time you rotate, you get horrible pain, it sends it down the arm, what can we do about it? So gentle exercises, first of all, is get up, change position, move. Make sure we do that little and often throughout the day. Try never to stay in the same position for more than half an hour. Once your pain relief has kicked in a bit, why don't we try a few gentle exercises? So simply rotating the shoulders, keeping them loose, going as far as you feel comfortable. Don't force it into the pain. Now, if you find rotating the head or side bending the head is causing some of the pain, don't force into it either. Do keep it moving, but just go before the pain. So if you can keep it going, but it doesn't aggravate, doesn't cause the muscle to jump up, doesn't cause the pain to get down the arm, keep it moving. It's going to be better for it in the long run than just avoiding the movement totally. And then obviously if you can keep the neck loose the other way, gently keep it moving there. So side bends, rotations, shoulder rolls, maybe even a little chin tuck, nice and gently, just to get it moving. But nothing should make the pain worse. Now, if you are getting some of this pain down the arm, what we like to do at the clinic is give people what we call nerve flossing exercises. And what this does is that the elastic band that is the nerve that goes from the neck all the way down to your fingertips, if it's not being moved, the ability for it to be stretched becomes lessened. And then, unfortunately, if you're not using it for a few days, you haven't moved your arm because it's been so painful, unfortunately the pain can become worse, because then when you do try to straighten your arm out or reach up into the high shelf, it almost becomes more sensitive to that stretch. So what we say is, can you just actually bend the elbow? And what that does is it just flosses the nerve backwards and forwards. Now you're in control, you don't have to force it, just nice and gently. If that means just doing it nice and slowly, nice and rhythmically, doesn't bring the pain on and doesn't make it more than a 2 out of 10 pain, yeah, that's what we're aiming for. And what we say is to try and do this 20 to 30 times every hour. It sounds like a lot, but believe it or not, when you're in horrible pain like this, you will stop using your arm. And unfortunately, we know that if you stop using your arm, the pain will only get worse. So get your pain relief on board, gently floss. Now, progression for this is, if that's not a problem, we can start to lift the arm up and we can start to floss it in a slightly raised position. If this is not an issue, what we can also do is we can start to add in neck movements if your neck is allowing you to rotate into that position. But start gently, ease into it, keep your pain relief up, and fingers crossed you'll be able to get on top of it. If for some reason it's not settling down, you are worried, one, you can always get in contact with us. Our contact details are down below. But things to be wary of: if it's waking you up constantly at night, if it's going down both arms, if you're finding your grip's getting weaker, all those kind of symptoms, if you're really finding that that's the case and it's really not changed in the last 72 hours despite pain relief and all these exercises, yeah, get in touch with us, or yeah, don't be afraid to get in touch with your GP. But basically, those are nice simple exercises you can do if you've woke up with this acute neck pain that might be causing referral down the arm. Start with those, but do get in touch as well. We can give you plenty of advice and plenty of reassurance over the phone or via email. Good luck, stay safe out there guys, and hopefully see you soon.